Hello, everyone, and welcome back to my YouTube channel. In today's video, I want to shed light on a topic that requires our special attention and compassion. So, yes, I'm talking about neurosyphilis. So, this serious neurological condition is caused by bacterium Treponema pallidum, and it can have devastating effects on the nervous system if it is left untreated. However, amidst the challenges, there is a hope. So, today we will explore how homeopathic medicines offer a gentle and holistic approach to managing neurosyphilis and supporting the body's natural healing process. So, if you are suffering from neurosyphilis or your loved one is suffering from neurosyphilis, then this video is definitely for you. So, watch this video till end for more knowledge and stay connected with us for more informative videos like this. So, before we delve into the homeopathic treatment, let us briefly understand the meaning of neurosyphilis. Okay, so first we'll talk about neurosyphilis. So, what is neurosyphilis? So, as we all know that syphilis is a sexually transmitted infection, that is STI, that spread direct contact with syphilis sores. And if syphilis goes untreated, the affected person is at a higher risk of developing neurosyphilis. This is an infection of the nervous system and specifically of the brain and the spinal cord. Neurosyphilis is a life threatening disease. This condition occurs when syphilis bacteria invade the central nervous system of the brain, leading to a range of neurological symptoms such as headaches, altered mental status, vision problems, and motor dysfunctioning. And if it is left untreated, so neurosyphilis can cause irreversible damage to the brain. If left untreated, neurosyphilis can cause irreversible damage to the brain, spinal cord, and other vital organs. So this is the exact meaning of neurosyphilis. I hope this is clear to you. Now next we'll talk about the causes and the risk factors of neurosyphilis. So, Treponema pallidum is the bacteria, as I have already said, that causes syphilis and subsequently neurosyphilis. So, neurosyphilis tends to develop about 10 to 20 years after the initial infections with this bacteria, that is Treponema. So, having HIV and untreated syphilis are the major risk factors for the neurosyphilis. Now, next we'll talk about the various types of neurosyphilis. So, there are five forms of neurosyphilis. First is asymptomatic neurosyphilis. Second is meningeal neurosyphilis. Next is meningiovascular neurosyphilis. Next is general paralysis. And the last one is Tevis dorsalis, which is the most important one. Okay, so these are the five types of neurosyphilis. Now, one by one, I will be explaining each and every type of neurosyphilis in an elaborated manner so that you can understand them very well. So, first type of neurosyphilis is asymptomatic. So, this is the most common type of neurosyphilis. It usually occurs before the symptoms from syphilis becomes visible. In this form of neurosyphilis, you won't feel sick or experience any signs of neurologic disease. Second type is meningeal neurosyphilis. So, this form of the disease usually shows up anywhere from a few weeks to a few years after a person contracts syphilis. So, symptoms include nausea, vomiting, neck stiffness, and headaches, and it may also cause a loss of hearing and vision. Third type of neurosyphilis is meningiovascular neurosyphilis. So, this is a more serious form of meningeal neurosyphilis. In this case, you would also have had at least one stroke. About 10 to 12% of those with neurosyphilis develop this form. A stroke may occur in the first few months following a syphilis infection, or it may happen a few years after infection. Now, next type of neurosyphilis is general paralysis. So, this form can appear decades after you are infected with syphilis and it can cause lasting issues. However, it's fairly rare today because of the advances in the screening, treatment, and prevention of the STIs. So, if it develops, general paralysis may lead to several health problems, including paranoia, mood swings, emotional troubles, personality changes, weakened muscles, and a loss of the ability to utilize languages. And it can also progresses to dementia. Now, last type of neurosyphilis, the most important one, that is Tevis dorsalis. So, this form of neurosyphilis is very rare. and it can start to affect the spinal cord 20 years or more after the initial syphilis symptoms and infections. And the symptoms include trouble balancing, loss of coordination, incontinence, and altered walk and vision problems. So, this is a broad classification of neurosyphilis. Now, next, we'll talk about the investigations and tests for neurosyphilis. So, there are several testing options when it comes to diagnosing neurosyphilis. First, we have is physical examination. So, to find out if you have neurosyphilis, your doctor may start by checking your normal muscle reflexes and determining whether any of your muscles have atrophied, means lost muscle tissues. Next is a blood test. A blood test can detect middle stage neurosyphilis. There are a variety of blood tests that will show whether you're currently having syphilis or if you had an infection in the past. Next, we have a spinal tap. So, if your doctor suspect you have late stage of neurosyphilis, they will also order a lumbar puncture or spinal tap. So, this procedure will provide a sample of the fluid around your brain and spinal cord. Your doctor will use this sample to determine the extent of the infection and plan of your treatment. Next is the imaging test. So your doctor might order a CT scan, and this is a series of X-rays that allows your body to be seen in cross sections and from different angles. You might also need an MRI scan. An MRI is a test in which you lie in a tube containing a strong metal. This machine sends radio waves through your body, allowing your doctor to see detailed image of your organs. And this test allow your doctor to look at your spinal cord, your brain, and brain stem for evidences of the disease. Okay, so this was all about the investigations and diagnostic criteria for diagnosing neurosyphilis. Now next we'll talk about the treatment. So what is the ultimate treatment? So yes, here we are talking about the homeopathic treatment for neurosyphilis. Now let's talk about the homeopathy. So as we all know that homeopathy is a holistic system of medicine that views the body as a self-healing organism with an innate capacity for balance and restoration. Homeopathic medicines are prepared from the natural substances and prescribed based on the principle of like your likes, meaning a substance that can produce symptoms in a healthy person can also stimulate healing in someone experiencing similar symptoms. So, homeopathic medicines for the neurosyphilis. So, in the cases of neurosyphilis, homeopathic medicines aims to address both the physical and the emotional manifestation of the disease, while specific medicines will vary depending on the individual symptoms and constitution. So, here are some commonly used homeopathic medicines for the neurosyphilis. So, first medicine which you can see here on the screen for the treatment of neurosyphilis is Merxol. So, this medicine is indicated for syphilitic affections of the brain and the spinal cord with symptoms such as tremors, weakness, vertigo, and mental confusion. It's also helpful for addressing secondary symptoms like glandular swelling and excessive salivation. The chancre may be single or several small ones on the penis in cases needing Merxol. The chancres are soft or indurated and superficial or deep, where Merxol is indicated. The chancres have a cheesy bottom and inverted red edges. The chancres may be painful and bleed easily. There may be secretions of the pus or yellowish fetid discharge from the chancres. Inguinal region is painful while walking. There is a pain in inguinal glands on pressure. Second medicine is cinnavirus. So, cinnavirus is useful for the cases of syphilis with red, swollen chancres. The edges of the chancres are hard and elevated. The chancre is located in the middle of the penis in cases where cinnavirus is indicated, and the chancre is most times indurated. Next medicine is Kelly iodatum. So it's a very useful homeopathic medicine for the syphilis with the deep chancres. The edge of the chancres are very hard. Thin discharges may be present with an offensive odor. There may be tendency to slow suppuration in the chancres, and the glans penis is swollen. Next medicine is Mercor. So Mercor is indicated for the chancres which are soft. The margins are dark red. The chancre is painful and it may bleed easily. There may be discharge of thin pus from the chancres. The surrounding part of the chancre is swollen with the heat. The next medicine is Syphilinum. Medicine addresses the deep-seated effects. So, this medicine addresses the deep seated effects of syphilis on the nervous system. It is indicated for the symptoms like severe headaches, vertigo, numbness, and the weakness of the limbs. The rash is prominent on the forehead, chin, front of the chest, and arm. An axis of the fine scales peels off from it. In some cases, copper-colored macule from top of the head to the foot appears. There is a biting sensation in the different body areas is felt at night. Along with this, there is a fever with excessive headaches. Body is extremely cold with a desire to be covered. Appetite is lost. Sore throat, inflamed pharynx, and ulcers in the throat may also appear. Next medicine is nitric acid. So, this medicine is indicated for the secondary syphilis with skin eruptions having prickling and itching on the skin. It is also indicated for the warts like growth on genitals and anus. The growth are large, jagged, and often pedunculated. There is a prominent spiking and pricking in them. They are painful to touch and sometimes they bleed on washing. Next medicine is phosphorus. So, phosphorus is a valuable medicine for managing complaints of hair fall in cases of syphilis. Hair loss is in general and in the pitches. The scalp is dry. A heated sensation is also felt on the scalp. Violent itching on the scalp may be present. Next medicine is thuja. So, this medicine is prepared from the fresh green twigs of the plant Thuja occidentalis, which is commonly known as tree of life or arbor vitae. And this is an excellent medicine to treat wart-like growth in syphilis cases. In males, these growth appears on the glands, penis, and perineum. They may be painful, especially on walking. And in females, the growth may be there on the labia, vulva, and vagina. They may have stinging pains and may also bleed. Warts may be also present on the anus in males and females needing thuja. Now, next medicine is phytolica. This medicine is prescribed for the neurosyphilis when the throat is darkened, painful, raw, rough, and dry. Tonsils are bluish or dark purple in color. Swallowing is painful. Pain from the throat may extend to the ears. There is a marked burning and smarting felt in the throat. Scraping sensation and excoriation are felt in the throat. Ulcers tend to appear on the tonsils. There is a deposition to hawk and clear throat is present. Mucus discharge from the posterior nares may be present, and apart from this, pain in the lumps may be present. Now, our last medicine for neurosyphilis is arsenic album. So, it is a wonderful homeopathic medicine for managing fatigue in cases of syphilis and from very little exertion. Restlessness is marked with fatigue. Anxiety may also be prominently present, especially at night time, with all these features. So, these are the various homeopathic medicines which can be used for the treatment of syphilis as well as neurosyphilis. So, that's all for today. In conclusion, I want to say that homeopathic treatment for the neurosyphilis offers a gentle and holistic approach to manage symptoms and supporting the body's innate healing processes. So, if you or someone you know is struggling with neurosyphilis, I encourage you to consult. Find this video informative, helpful, and especially valuable. So, please give this video a thumbs up and subscribe to our YouTube channel and hit the notification bell for more insights into the world of homeopathy and natural healing. So, see you guys in the next video. Till then, stay safe and stay healthy. And if you are suffering from neurosyphilis or syphilis, you can contact us for online appointments. On the screen, you can see how to contact us for online appointments. So, that's it for now, and thanks for watching this video.